better understand the problem within their communities. Welcome. And so because of that focus, we decided that the next time we had the opportunity to come together in person, we wanted to focus on OD maps. So that's how we got here today. And we're very excited with our two presenters, who I'll let them introduce themselves. But yeah, before they get started, if we could just go around and everyone could let us know their name, what tribal nation they're from, and just a little bit about your role and how in the past or in the future you're hoping to work in this behavioral health opioid prevention space. And I will start over here with Erica so we can end with you and get started. Oh, and if you could, I know it's annoying because we're a small group, but if you could use the mic, that will help the group online be able to hear us.
Good morning, everyone. Yate, my name is Erica Charlie. I'm one of the program managers at USET under THPS, but I manage the tech fee grant that I work with Emma and Kaylin as well. So I'm really excited to meet all of you guys today and see kind of what your thoughts are on this. So we're really excited that we're able to meet today. So thank you guys.
Hi, I'm Lisa. I work for the Mashantucket Tribe with the Social Services Department. I work with folks that have co-occurring disorder.
Good morning, everyone. My name is Kaylin Jackson. I'm an evaluation specialist with USET. I've been here for a year now, and I'm really excited to hear everyone's thoughts.
Good morning, everyone. I'm Anita Brock. I'm the Deputy Tribal Administrator at the Catawba Indian Nation.
Good morning. I'm Haley Wade. I'm the Director of Behavioral Health for Catawba Nation.
Good morning. I'm Mike Ligon, the Deputy Director of Public Safety for the Catawba Nation.
Hi, I'm Amanda. I'm a program coordinator with USET. I'm mainly working with behavioral health.
Hi, I'm Bernice Jordan. I'm one of the program managers, opioid prevention work, data improvement, and also helping out with the opioid task force. I'm going to go ahead and give it over to.
Hi.
I'm Anna Brown Jackson. This is my first time at USET. I'm from the Narragansett tribe, and I'm coming as a general attendee, but I do see abuse in our community, just like probably in a lot of many others. So I'd like to bring the information back to the tribe.
Hello, I'm Mark Tuttle. I work over at Eastern Band of Cherokee Indians, and I'm the epidemiologist there.
And good morning. My name is Allie Burrell. I'm the ODMAP program manager, which is based out of the Washington-Baltimore HIDA. Okay. 1 second while we get the technology going. Okay, perfect. Technology is good. Okay, so again, my name is Allie Burrell. I'm the ODMAP program manager. We are a program that maps overdoses out of the Washington-Baltimore high intensity drug trafficking area, which is one of 33 national, they're called HIDAs, that work towards dismantling drug trafficking organizations, connecting folks with different resources, and most importantly, this is where ODMAP was born and is currently housed out of, again, Washington, Baltimore area. So today, my goal for my section of the presentation is I'm going to go over the 101 of ODMAP, and then Mark is going to talk about his experience being an ODMAP user and what this looks like in his tribal area and his experience working with the program itself. So we all are here because we all know that overdoses continue to increase. It is something that is ubiquitous across the country. We threw this together. So last year we saw for the first time 100,000 overdose deaths. However, we know that that's just deaths. We know that there is a significantly larger number of non-fatal overdoses occurring. And that we also know that unfortunately, this is not something that is new. It is part of our history all the way back to the 1800s when you had the opioid crisis when it came to like San Francisco, and I don't know why I'm blanking, sorry. But it's something that has adapted over time. We see an increase in methamphetamine, and then we follow up with an increase in cocaine. It just continues to be this cyclical event that has occurred throughout our nation's history. This has been impacted significantly, of course, by the increased rise in fentanyl, which we first started hearing more and more about in the late 2000s, early to mid 2010s. We saw it really increasing, but in the last few years, we've seen it continuously increase again. This is the continued rise of fentanyl. So this is the cause of deaths in the United States, and you can see here that fentanyl poisoning in the last year topped over 40,000 deaths. And so a little bit about ODMAP. So ODMAP was developed out of the Washington-Baltimore HIDA. The story goes that our director, Tom Carr, went up to my brand new deputy director, Jeff Beeson. He had been there for about 2 weeks and said, you have 30 days to make a solution to track overdoses in real time, fatal and non-fatal in the Baltimore area, and it's going to cost $0. Have fun. Luckily, we have a great team and we were able to create a prototype that we brought on 3 counties in West Virginia, and then it grew from there. But it was really focusing on the fact that public health, we know we can't solve this crisis alone. Public safety, we know we can't arrest our way out of this to solve this current epidemic. We know that retroactive data is as good as it was a year ago, and that collaboration is what's going to help us make a real impact. So that's where ODMAP came from. ODMAP is a free web-based tool that provides near real-time surveillance of those suspected overdose events to support public safety and public health efforts to mobilize an immediate response. You're going to hear a lot me say near real time because that's key, and it's fatal and non-fatal. It's anything that's a suspected overdose. We would rather areas, because we're not a system of record, in a way be more over-report in a way. That way there's at least a better preparedness for what's really going on, rather than under-report by saying, well, we're only going to report information on fatal overdoses. Well, then you're removing an opportunity to create a more broad response program. So you'll hear near real time. Remember that we're not a system of record, and we'll get into that here in a second. So ODMAP. We were created in 2017, and here's where we are today. As of last Friday, I got an email that said this is a new approach. So we currently have agencies that are working with ODMAP in all 50 states, the District of Columbia and Puerto Rico, which is approximately 4,100 agencies. That equates to approximately almost 27,000 users across the country. We now have 28 states as of, again, last Friday. The state of Idaho brought on their Idaho state troopers. All of them are going to be working on ODMAP. So we have 28 states. We have 18 current APIs, which means we are getting that real-time information directly from usually EMS providers. So when someone overdoses, they respond, they hit submit on their usual paperwork, and then it populates into ODMAP. So usually within 2 hours of that overdose occurring, it will populate on ODMAP. And then unfortunately, a number that, as we work with agencies continues to grow, which is helpful for us when we look at it from an epidemiological perspective or a response perspective, but I hate to see it continue to grow, is that we now have 1.5 million overdose events entered into ODMAP, and those are only since 2017. So we'll get into ODMAP 101 here. So ODMAP is not meant for the general public. And this is really key when we talk about making sure that we're providing additional efforts to keep the confidentiality of the persons who have overdosed. So ODMAP is only eligible to federal, state, local, and tribal law enforcement and criminal justice personnel. This includes medical examiners, coroners, and public health personnel. Again, that cross section between public safety and public health. It also includes licensed first responders, so fire and EMS, hospitals with emergency departments, but because, I'll get into this in a second, we as ODMAP do not own the data that is submitted to us. We do not allow for research without connecting with the agency contributing data. So we do exclude those associated research units with universities. And all agencies must sign a participation agreement. This is that connection between our two agencies saying this agency is providing information to ODMAP in good faith, and this is what we are holding ourselves accountable to that agency. So we go into this in a mutual understanding. And then it outlines also our policies and procedures. So this says a lot about how if your agency submits information over to ODMAP, so the Eastern Band, if you guys were to submit information over to ODMAP, the data ownership remains with Mark. And that's why Mark can show his data today, but I can't put my data or that data up on here because I don't have his permission to do that because it's being video recorded. So we think this is really key because a lot of our agencies, the reason why they use ODMAP is because of that data ownership. That means we can't go and do publications with it without their explicit permission. So when we talk about data though, how does data populate into ODMAP? And I promise we will actually see a map here in a little bit, but we got to get to the data first. So ODMAP works with agencies where they're at. So we have a couple different methodologies on how agencies can enter ODMAP information. So there's the manual entry form, which is what you see up here. That's going to be web-based. So you can enter it in out in the field. If you're at your computer or in a squad car, you can enter it there. We also have OD form, which is a law enforcement specific methodology for folks that are using a program called Case Explorer. And then we have our application programming interface. And I think this is the easiest one to use because once you set it up, you're not asking anyone else to do any additional data entry in anything else. So another thing I think that we have that helps us connect with agencies is we actually don't ask for a lot of data. We ask for enough to help drive those decisions and see what's going on, but we don't collect any PHI, and that's intentional. So for ODMAP, you only have to have 4 data points to submit information over on a case: the date and time of the incident, the location of the incident, the outcome, so if it was a fatal or non-fatal overdose, and then naloxone administration. Agencies have the opportunity to submit additional information, such as suspected drug. This is one we really encourage if it's an option, because this allows people to see if there's an increase in a fentanyl batch that was coming through, or is it a continued use of heroin in your area? Are you looking to see an increase in methamphetamine? It just allows you to kind of see what's going on, because in some ways, how you respond to a batch of fentanyl in your community versus a batch of methamphetamine is going to be slightly different, because it will require naloxone versus non-naloxone methodologies. There is an option to submit information on age and gender, transported to hospital. Our brand new one that I'm really excited about as a public health person is we now offer the option to track naloxone leave behind. So if you have a leave behind program, you can indicate that naloxone was left behind. That way you can start to see kind of the saturation in that community on that project. This is a little bit about the APIs. So again, it's a direct and automated integration. So just one system sending information over to the other. It uses this format called a REST, which means it's pretty simple as far as APIs go. We say we did that intentionally because it's developer friendly and allows us to be compatible with all record management systems. So if anyone says we want an API, we have yet to say, oh, we can't do that. And while it does require some additional setup at the beginning, deciding what is an overdose in based on your system, defining that data definition and doing some tests. Once it's done, it's done. And again, your folks that are, your first responders, your police, they don't have to do anything additionally. They can continue to do their jobs, just entering their usual case information. So one question we get quite a bit, since again, we are not a system of record, we don't collect PHI, but there's always a question about HIPAA, because we are asking for information about individuals. So we worked with a lot of different folks, including LAPA, which I do not remember the full name. It's the Legislation and Analysis. It's like a think tank in DC on legal stuff. I will get you the full name, but we worked with them as well as several offices of attorneys general to make sure that we could get a formal understanding of how ODMAP and HIPAA related, to make sure we weren't violating HIPAA by collecting this information. And so because we're not a system of record, we only collect information on location, date and time, fatality status, and naloxone. We don't have to worry about that. The information captured by ODMAP is not considered PHI. The location that is submitted to us is translated into a geolocated point where that overdose has occurred without any additional information about that specific individual. So for example, if in ODMAP on the manual entry form, as well as the API, you can enter your information for an address. That address is geocoded automatically and then deleted from our system. So all we have is a string of numbers that relate to a point. We cannot narrow it down. And on the map, you're not able to zoom down far enough to see where that particular house is, nor can you find out who all was in that house at that moment in time. Which individual person in that house overdosed. There's not really any way that you can identify that specifically using ODMAP. And then we do have a zoom function restriction, which just makes sure that you can't see anything beyond street level. So within ODMAP, you will literally get to a point where you can't scroll anymore, and that was intentional. So ODMAP, this is our big feature, is the national map. It's cross-jurisdictional, and this is really important because we know that agencies need to collaborate and talk to each other because, your drug dealers don't stop at a county line or some artificial line saying, I got to stay within my boundaries. No, they're going to cross over and go where the demand is. And so that cross-jurisdictional opportunity allows you to see beyond your county, beyond your zip code, beyond your state. Everyone who joins ODMAP sees everything on the national level. So you will log in and you see a national projection of the last 24 hours. And those are every overdose event that happened in the last 24 hours submitted to ODMAP. Right now, that average is about 1,100 overdoses a day that we see at any point in time. But we also offer the opportunity to look more closely to home. So we have filters, we have a heat map option, we have built-in charts, we have spike overdose and statewide alerts that I think are really key when we're looking at a response approach, because it lets you know when there are events going on that maybe are a little bit of an anomaly or a larger indication of what's going on spike-wise regionally. You can also add personal data. So if you have information on like naloxone administration sites, harm reduction sites, things that are based on your organization, as long as it has a geolocation, you can upload that and then map it next to the overdoses. We don't keep that information. So you can upload anything that might be confidential. It will just literally map it. And then when you refresh, it will go away. So that's an option. We find a lot of public health folks are using this recently because they can map things like harm reduction initiatives and make sure if they need to shift a mobile opportunity that they can go and use that. And then we also, again, multiple agencies for an area. So we have states where they have statewide EMS APIs, but also their local law enforcement are the ones that are entering fatal overdoses. So that way you get a broad approach about what's going on. And then we have some areas where in a way they kind of battle to see who gets to be on the map because they have 5 agencies that are all submitting. This particularly happened in the state of Florida. And so we have some methodologies that allow us to make sure we're capturing duplicates. So we look at the date of the incident. So with the same date, within an hour on each side of the incidents, and within 285 feet, and that was based on some analysis that we did, it will register that as a probable duplicate. And then it will make sure that we only keep one unless you indicate that it was a multiple victim incident where perhaps there's a party, multiple people overdosed on a bad batch of drugs coming through, which we do unfortunately hear about, but we want to make sure we can capture that 4 overdoses occurred at that particular site versus just one. Or hospitals, that kind of thing, where maybe based on location, it would automatically deduplicate for a hospital. Now you get to see a map, guys. We've been waiting for like 20 minutes to see a map on ODMAP. It does exist. It's not just words. So this is the national map. So again, if you're an eligible agency and you get vetted, we send you information on how to log in. You set up the login, and this is what you see when you automatically join. Now this is dummy data because again, it's being recorded and we did not get permission for the data providers. So we're going to provide some dummy data. So none of this is actual overdose events. But what you see is it auto defaults the last 24 hours. Gonna try to get fancy here for a second. So we also default with some summary statistics so you guys can just kind of see what's going on. Anytime you use a filter though, this automatically updates. So those are gonna be the real numbers that you see. sorry, we've got those built-in filters that I was talking about. And again, you're not just restricted to your jurisdiction. You can look at this nationally. So say you have family across the country on the West Coast. You can look at everything from California, Oregon, Washington, Idaho, Utah, not Utah. They don't have any data currently. It's a long story. But you're able to see all of that information. If it's included in ODMAP, you are able to see it. So this includes things like filtering by the dates. So whether it be that quarter, year to date, historical information, as long as it's there, day-wise, you can filter it. You can filter it down to the state, county, zip code. And in some areas, we do have police jurisdictions. We do have the opportunity to filter by agency. So if your agency is submitting information, you just want to see where you're at for the year, you can filter at that. Or if you're interested to see what a partner next door is looking at, you can do that as well. You can filter up to like 7 agencies or locations at a time, just as a heads up. Then you can also do type of drug, if that drug is submitted over, as well as outcomes, so fatal or non-fatal. So it really allows you to dive deep into the data to help answer some of those questions that you might be starting to see around your area. I'm gonna it's gonna autoplay, but we were working a lot with the state of Montana and their drug intelligence officer and public health analyst with the overdose response strategy. We're doing specific outreach to their tribal nations. And so they actually asked us to go ahead and make a quick tip video on how there is an option to go ahead and just change the background of ODMAP. And it will automatically indicate the current boundaries of tribal nations on ODMAP. So you can go ahead and start to see that. We're obviously working continuously on trying to improve that. So if you have ideas, we're happy to look at them. But we did notice that this is already kind of in place. And so we just wanted to highlight this through a like 20-second video clip. There's no sound, don't worry. But this is all on our social media as well as our YouTube channel. But basically you can just change the background and it will zoom in here in a second, I believe to Wyoming. But as you can see, those areas in lighter gray, these are going to be the current boundaries that are included on the Esri map. So we just like to say that that's already in there in case there is something that is impacting your specific area, that that is an option that's already pre-built in. We've also got built-in charts, as I mentioned, to do some quick analysis. This is all luckily all downloadable. So you can download all of these charts into a PNG file, CSV file to do some analysis, or you can also do it in a vector file. This is nice so that way if you're doing printed products or doing a presentation, you don't have to make charts, they're already done for you. This includes things by type, so outcome, fatal, non-fatal, day of week, hour of day, by month, multiple county and state. So we'll show you here in a second. You can actually look and see in your different counties next to you, wherever you'd like, you can look at 7 at a time and see how they trend together. So if like in, I'll show this an example here. In DC, we're along I-95, which is a well-known drug trafficking corridor all the way down to Florida and then up into Maine. Well, we can go and I can look at any of the 5 boroughs in New York City, Philadelphia County, Baltimore County, DC, and then Atlanta, and I can see when they spike together. I can see when they increase together. So that way, if I'm getting a batch coming up out of Atlanta, I can see how quickly it's going to impact DC. And I can look at this over time to establish that trend. And then you also have an option for a grid. This one is not downloadable because it does provide that information, but it's a grid so you can go and see more case specific information. You can look and see who submitted it and connect with that particular agency or that point of contact. So there is that option there as well. I apologize. I don't know why I'm getting winded. This is an example of the chart. Again, just some examples here on the side of what you can see, but this is what you'll see built in, and it is ADA colorblind scale approved, which is why you will see these bright colors, but we do provide that opportunity for you to download them and do whatever you would like with them. Now, spike alerts. This is, I mentioned a little bit earlier, this is our other feature besides national map that I think we are most known for right now. So spike alert allows us to help agencies become informed about when there is a spike. Now, we've all heard the word spike and wondered, well, what's that mathematical number of a spike? Well, we worked on looking at an algorithm that would allow us to help agencies understand what a number for a spike might be. So the spike algorithm that we have is a recommendation. Agencies can pick their own. Ours looks at the retroactive 90 days of data, so it's constantly improving from that machine learning perspective. And if it's above 2 standard deviations, then it will trigger a spike alert. But a spike alert right now is you get an email. So you'll set up a spike alert and you say, for my area, I want to know for that county, because they are county based, I want to know for that county when 5 overdoses occur. Well, when it hits 5 overdoses within a rolling 24-hour period, you get an email. You can also set up text messages. We just learned that recently. So you can do that. And then once it drops below that 5, you'll get an email saying the spike is over. So you can customize that as well. So if you have different groups in your area where that need to know about a spike for maybe a spike response protocol, you can say, deploy phase 1 of spike response protocol. Everyone on that subscriber list will be notified so they know to follow their protocol and do their action items from that. Or you can also set up multiple spike alerts for any county. So say you want to know 5, 10, and 15. You want to know every single one, you have options there. Now it is the morning, but this is my favorite piece of trivia, which says something about me, I think. So for spike alerts, can anyone guess the highest number of what the highest recommendation was for us for a rolling 24-hour period, which means you would be notified when this number was hit based on our automatic threshold? Anyone? Just throw out a number. There's no wrong answer. Sorry. So we have this recommendation threshold. Can you guess what the highest recommendation ever seen was? Within a rolling 24-hour period, yes. For the county alone, yes. Is significantly higher than that. Is the highest one I've seen. Yes, and that's key. Is it does change over time. It's seasonality. We know things will change. But any guess? How much? No, higher than 50. 150, not quite. Lower than that. Lower than 150. Do we have a, what was that? Lower than that. I feel like I'm auctioning off stuff. Lower than that. Close, 98, it's a little bit lower. 91. So whoever said 90 wins. There we go. Okay, so 91, which means that in Cook County, Illinois, so Chicago, they have an API. So we get information for every non-fatal overdose for Cook County. That means that within a rolling 24-hour period, if they saw 91 overdoses, they would get notified. And I got notified all the time. They were having a really bad summer. Now, because it changes over time, they're down to 45. So we like to see that. Not to say it's directly correlated at all with ODMAP, but it is nice to see those changes reflected where you can go and look and say, did something change? Are we starting to see different trends over time? Are we starting to see maybe drug trafficking routes change? You never know, but you can start to ask those questions by seeing that the spike threshold changed. That is the highest I've ever seen, was 91. Thankfully, I don't want to see that again. Okay, so spikes. The reason I bring up spikes is I'm a very curious person. I like to see how things are related. And so one of the things that you can do is that because ODMAP is cross-jurisdictional and you can see everything in your area, we like to look and see how spikes and how counties are related to each other. So we look, I'm going to kind of broaden this out as we go along. So we'll start with South Carolina and the USET region. So we've got from August 11th to August 17th, there was a spike alert issued in Lexington County, South Carolina. And these are our spike alerts. So we just did them based on our recommended threshold at the time for consistency. So we had 4 overdoses in that particular county that started at 1509, then down to York County at 1103 3 days later. And then 3 days after that, we saw 3 overdoses. So you can see some connections there. Obviously, they're locally. You can kind of see some spread along I-77 and I-20. Well, let's look at it on a more large scale regional level. So again, I-95 is a well-known drug trafficking route, major interstate. Never drive it during a holiday. You will never move. But from May 4th to May 10th, we were able to kind of see some patterns to see if we could look and see how quickly things impacted one another. So Oneida County up in New York, we saw the first spike that occurred on May 4th, first thing in the morning, and it was 4 overdoses. Well, then down in DC, we got notified the following day, almost exactly 24 hours later, we saw 10 overdoses. Now, we know by the time we see overdoses, the drug traffickers are long gone. They're going down to their next stop. Things are spreading out. So then we saw Chesterfield County, Virginia, a little bit further south, same day, about 12 hours later. So again, going down 95, by the time we see overdoses, people have already sold and distributed that information, and those drugs are out in the community. And then we take it down further south into South Carolina, which South Carolina is interesting because they get the northern route and the southern route. They kind of meet in South Carolina as far as trends. And we saw a spike at 5:10 around noon, and it was 3 overdoses. So if I were the public health analyst or anyone using ODMAP out of DC, I would make sure that I'm getting all of these counties registered, because I'd rather be over-informed and make sure we can build those protocols off of that to say, you know, if I see Oneida County and Chesterfield County spiking at the same time, go and talk to my folks on the ground, see if law enforcement see anything about like a stamp bag going around, but be more informed so I can push that information out. So you can also look at this not as just a spike, because spikes we know are a great sign, but there are increases that don't trigger a spike. So this is a non-regional approach looking at relationships. So we saw increases related to a spike out of these 3 cities. So the Twin Cities, Chicago, and Toledo, they all spiked together pretty consistently within 36 hours. But we also saw increases in Missouri and Kansas. So while it might not have triggered a spike, I would still, if I'm in the Kansas area, I would want to start monitoring all of that as well, just again for that preparedness piece. And this is the last one, I promise, but this is my favorite one because we can extrapolate a little bit out further. So we looked to see if we could explore anything along national drug trafficking routes. Well, Los Angeles County has an API, so we're getting similar to Chicago, real-time non-fatal overdose information. And so we know that drugs will come up from the southern border, and one of the first 2 stops is going to be San Diego and LA. So in LA, we saw a spike of 22 overdoses on April 7th. Then we saw a Chicago spike 3 days later with 43 overdoses. And then we saw the Toledo area out in Ohio. The following day, 7 overdoses. And then right around the same time, we also saw the Ramsey County in the Twin Cities, which is the St. Paul side, with 5 overdoses. Now, we wanted to see if we could kind of extrapolate, like, might this be related? Because as I mentioned, we don't necessarily have great data from Utah. Nevada, most of the data is concentrated on the Vegas area, and Colorado is working on building theirs up. Wyoming, Casey Patterson enters all of their data, but it's kind of based on population centers, and then Nebraska, not so much. So, but we know that I-80 is a well-known drug trafficking route as well. There's some great stops along the way. If you ever want to drive across the country, I-80 is beautiful, but we did some math on Google Maps, and it's totally doable. If somebody left LA and then 3 days later saw spikes in Chicago, it is totally doable. And we know that I-80, again, with our connection to our intelligence support center, that this is a well-known drug trafficking route. So if I was based out of Chicago, I would set up for Minneapolis, Toledo, as well as potentially LA, because we know that, again, drug dealers don't stop at boundaries. They're going to keep going along those trafficking routes to get the product out. So all this is saying there's a lot of things you can do with ODMAP using specifically spikes. You can use those chart features. There are things that you can start to answer, but you can also drive decisions based on this. And I'm going to hand it over to Mark to talk about ODMAP in the field, if that works for you. Do you have slides? Are you just want to talk?
No, yeah, I was just gonna
Perfect. Then I
talk.
set a slide up for you.
Oh, what, is there more than this or?
No.
what- Oh,
Well,
that's just
there
that
is, but
slide.
just go
Oh. All right.
Oh, does anyone have any questions or do you want me to wait till after Mark? I just had a question about, there's the one line. Sorry, I got to the slide and I was like, okay, Mark, great introduction time.
Yeah, I just had a quick question about the Zoom function as far as the street level. So I just want to make sure that I'm understanding. Is it like individual streets or is it more like a multiple? I guess my concern is that there are areas in this country that are rural enough that could technically be personally identifiable information.
Yes. So it is to where you cannot identify an individual house. It's pretty above. I'm happy to show you too afterwards, just so you can
Okay.
get an idea. Usually we demo it live, just to kind of show you, but we have this conversation with everyone about like, oh, well, on our rural areas, there's one house there. So we remind people, not for the general public, also remind people that law enforcement can't use any of this information to go and arrest anyone. They also probably were on scene at that overdose event potentially in some areas because they respond to them. But it does limit it. And we work with Montana so for like example, we work with so many rural states, South Dakota, Montana, Colorado, Utah's in the works. Like we work with areas that are super rural and that was their first concern. And that's why we went and asked a bunch of folks to make sure like, is there anything we need to do to change? And we haven't had any issues so far with people going and trying to identify individual houses. And we have 4 written attorney general's findings on PHI. I'm happy to share. We try to do our due diligence because we do always get this question and we don't want to out anyone as an overdose survivor or victim.
For sure. Just one more question also. So I did see just looking through that, it looks like you guys are including mostly just OD information. Is there anywhere else to input other negative outcomes that aren't necessarily OD related, like tainted drugs that maybe, have substances in them that won't cause an overdose, but will make you sick?
So right now, the only option that we have to provide additional information related to like overdose events, like drug specific information is through our partner program at WB HIDA called Case Explorer. It's a national deconfliction service. And so we have a connection point called OD Form where law enforcement who are Case Explorer users, they basically enter that information into ODMAP. Only the information that you saw here is pushed over. Once they click OD Form, then they start the case information on the side. They are on 2 different servers. I do not have access to like Case Explorer, anything like that. But that is where we would store more identifiable things like information on any witnesses, any victims, information on any like stamp bags, or if there was a drug tag in the area, like out in Philadelphia, xylazine was a big tag for a while to know that it came out of Philadelphia. So that's where that would be housed. Right now, we're not currently checking that in ODMAP. And that's, I think we've explored that a few years ago, and it was just kind of we wanted to keep in our space about where we were and make sure we didn't ask too much of agencies. But that is a great idea to potentially bring back and explore again, knowing just how important understanding non-specific overdose factors are. So thank you for that.
Thanks.
So,
People
oh, okay. Dear Lord. So in saying this, coming from a law enforcement background and actually utilizing this from time to time, if it's isolated to only law enforcement officers, who are putting this information in and the people who y'all are allowing in, why wouldn't you be more specific in regards to the address? Because we are uploading those addresses and stuff into the OD mapping, unless I've missed something here.
So we don't, yeah.
why-
So that gets into the PHI world where we don't want. So I trust our I trust our OD map users, but I don't want someone who is trying to be doing something with nefariously to go and try to pick the individual's house. So we don't keep the addresses. Actually, we take them, we put them through a geocoding system, and then we delete those because then that becomes personally identifiable information. And from my experience as a public health professional, if somebody said, oh, we have law enforcement and we have PHI and public health, they're not going to join. It would become only law enforcement because there is that concern, oh, well, law enforcement's going to go on arrest. I spent half my day dispelling that about ODMAP because there's just not enough information to even try to do that. It doesn't work.
It doesn't work that way.
Yeah, exactly. And so that's why we've removed the option to keep the address and just demonstrate it. You actually, as an ODMAP user, you're not even able to see the latitude and longitude of any particular point unless you are the one that enters it. So like Mark's agency can see the lat long of overdoses on his end, but I couldn't go and see them as an ODMAP user. Even with my system admin level, I can't pull that information because it's his information to share.
Got you. Okay.
So we recently registered, our Division of Public Safety registered with ODMAP at Catawba Nation. And then our York County Sheriff's Office also utilizes ODMAP. My question is, as the Behavioral Health Department and we closely collaborate with public safety, is it beneficial for us to also register? Or I know you mentioned a way to prevent duplicating entries. So can you speak to that a little?
Yeah. And I will preface, just because you sign up for ODMAP doesn't mean you have to contribute data. So you can register. So for example, a lot of behavioral health agencies, they don't necessarily have data to enter because they are partnering with their local law enforcement, their local EMS. So that information is already entered, but they are valuable partners at the table. Similar to how if law enforcement wasn't entering information, but EMS was, they also need to be at the table when it comes to ODMAP. So that's why you're not required to enter information into ODMAP to use it. If you do decide locally, I would recommend reaching out and deciding who's going to be responding or who will be entering what information if you collaborate together. That way you're preventing duplication, because if there's something where like our duplication detection system maybe missed something, which we're not perfect, we're really good, we're like 98%, but there's always that 2% margin of error. We would hate to kind of expedite that or make it larger than it is with one you can coordinate together. So for example, we recently changed this, but we had an example in Florida where the police decided they wanted to be like the point associated on ODMAP. So their data analyst just doubled the numbers. She just went ahead and entered the duplicates anyway. And so we want to try to prevent that by coordinating with everyone together. So you don't have, it's the county where Orlando is. So it doesn't look like Disney has twice the number of overdoses that they should. So things like that. So we always recommend coordinating locally. And it sounds like you have good relationships with them. So I would just kind of maybe say our law enforcement will enter this. Is it South Carolina?
Yes.
So you guys
York
have
County.
York County. So you guys have the API with EMS. So just kind of coordinating to make sure you're capturing enough, but not entering so much that maybe something gets lost.
Great. Thank you.
Of course. Any other questions before I hand it over to Mark? Okay, I'm gonna hand it over officially now.
I could show the BCI data.
Yes, so
on
just
here.
pull yours up.
Yeah. Just so they can see. Yeah.
How long do you want it for?
No. Let's see. I think it's usually just go up to the top and do North Carolina first, and then it will pop up a lot easier. Yeah. And then I think it's Cherokee.
Okay.
Yeah, it starts with Cherokee. Cherokee Tribal EMS. Yep. Mhm. Yeah, year to date's fine. Yeah. Just to show them what it looks like on there.
Yeah, can you show that Zoom feature too on the? Get it off my face. Show 'em how it-
Mhm.
stuff.
Yeah, that's what I was gonna,
Okay.
just so they know.
So
Oh,
Mark
that's
has-
not shown on there yet, but, okay.
So Mark has agreed to show information that he has provided to OD Map. So we're gonna pull up OD Map Live, but just for reference, it only shows the information Mark has and his agency have included in the website. So just want to make sure everyone knows that this is.
Yeah, so this would be good just so y'all can see the Zoom capability and to actually show what it looks like for actual data on there. All right.
Feel free to
Yeah.
mess around.
Okay, so this is our tribal EMS. This they put in our data for us. So let's see, is this touch screen or no? No, okay. Well, let's see, where's, yeah, where's the zoom button there?
Oh,
Oh,
no, minus zoom in. Yep.
that's right, I can do it this way too. You can click on it and zoom in.
I just do the like.
Yeah. So this it'll update and it will go a little bit more. There it goes. So this is our the tribal boundary. I don't know, hopefully y'all can see this here. Maybe I can change the base map. Wrong one. That one.
Oh.
Yeah, where's that at?
Scroll down.
Oh, you just do that. Okay. Okay. See if that pops up on there. Okay. See the chart. No, that doesn't.
No, that's the one
Yeah.
as well.
Maybe you go
Scroll.
two
Yep.
fingers. Okay.
Sorry. it's not in that.
I'll just do this hybrid here.
It's time to
Just
get up
so
and
you can
stretch.
Okay, so this is the Cherokee Qual boundary here. So this is, we have 78 suspected over. This is from the first of the year till today. So we had 78 suspected overdoses and 7 fatal overdoses and 67 they were administered naloxone. So, oh, sorry. Hopefully y'all can hear me still, but the 78 total overdoses, suspected overdoses, and 7 suspected or fatal overdoses and 67 naloxone administered. So, and if you can try to zoom in, I'll show you, like, this is basically, that's as far as you can go right there, right? Is it?
You're rotating.
I'm rotating it.
As far.
Yeah, I think
The
that's as
Zoom
far.
with background I haven't used before. So yeah, this is
Yeah.
as far as it will zoom.
Yeah, so this is as far as it zooms right there. So you can see, you can get different base maps and everything on there too, and you can see like different streets. I think the street view one is probably better to, yeah. That's probably good. So you can see a lot of the streets. So what we do, every week I'll send basically a snapshot of this to our syringe service program. So they go out into that area and they'll go and just like set up, we have a syringe service van and they just go out and knock on doors and just say, hey, we're out there. If you all need any naloxone, they'll give them naloxone and just kind of set up in just the general area. So they're not actually going to the actual person's house, just the general area that overdose happened. And so, but that's one way that we use OD map. So other way, of course, we have all the data on here. I'll show you all the data here. So you can see here, so this is overdoses by type. So you have the non-fatal no naloxone, and then you have the single dose naloxone non-fatal. Then you have the multiple dose naloxone non-fatal. Then we have the fatal no naloxone. So that's one we really don't want to see. But and then also we don't want to see this one as well. But this is the multiple dose naloxone. And then you can go see day of the week. So you can see Saturday has been the most for this past year. Monday was the lowest. We got hour of the day. So you can see this is based on UTC time. So I forgot what that stands for, but you might know. Universal, yeah, time. But you can tell the hour of the day here. So like 6 p.m. here, 7 p.m. So usually right around midnight is the hot time. And then this is suspected overdoses per day. So this is starting off at January and then goes over to October.
So you can also really fast. So if you click on this and drag over, so there's a large number of kind of increases here, you can zoom in and start to look at specific days.
Okay. And then this. Oh, so this right here, this is for January 1st till today. So then our tribal population is right around, it's on boundary, it's around 12-ish, but it kind of fluctuates because we have the casino, a lot of tourists and everything too, so. And then this is county. So this one's not, this goes by North Carolina. Not everyone in North Carolina uses it for sure. So it's kind of difficult to see this one. So that one I don't use, but these are some good stuff. You can definitely see like this is by month. So what is that? June. June was our hot month, and then lower months. So it's definitely some good data there. And then you can actually, let's see. I think that's all on there. I can show you, let's see how we do. Oh yeah, we can do that.
So if you click on any of these dots, so there's some information is stored with the dots. So we talked about how there's data ownership and some data is not shared. So like location's not shared. So like if you click on here, this is, oh, sorry. So if you click on here, you'll see the information that's included in each of these points. So you get the incident date and time, the incident type, the county that it's part of, the state, the zip code. And then you get, if drug information is provided, you get drug information. So methadone. And then if it's ever updated, so agencies can go in and update it. So if that person was entered as a non-fatal by EMS, but perhaps that person died at the hospital, you can go in and edit the records. You can do all of that. But this is all the information that is provided. So you don't see anything along the lines of age and gender if they're submitted, and you don't see any latitude and longitude that is included as well. So that's what you see as an ODMAP user for every single case.
Yep, and you can see like this is our EMS provider. So he was the one that actually updated the data, and then not all this stuff is entered in there, but we enter all the this other information. So suspected drug and everything there. So, and then also there's two that actually happened right there. That's why it's one of two. So then you can go over, and then there's another one. So the following day, right around the same area. So that's why it looks like it's right there. But any question?
Using the map function
So using the map function, can you zoom in? I mean, how far can you zoom in essentially that's as far as you can get in?
So
Looks very different depending on the area. So like if you were to zoom in on like Charlotte, or I'm sorry. So if you were to, so thinking North Carolina, if you were to zoom in on like Charlotte or Raleigh, the map will look very different. Obviously, there'll be more neighborhoods, a lot more streets, but it's the same view level. So you will, this is, I mean,
So you can see street level in a major city.
yes, but this is the equivalent to street level. So it's all the same zoom restriction. It just looks a little bit different. So if like New York City, they look like they're all on top of each other, and that's
Yeah.
just because there's a lot of apartment buildings. So, but like here, this is it's not going to let me, I can zoom out, but I'm going to come down here and this is as far as I can zoom.
Another question regarding responsibilities for reporting. So if EMS and police are kind of like the primary reporters, but given Haley's remark about public health reporting, do you have instances on Cherokee where it's not reported or 911 is not called when a person's revived? So that's what we're thinking of, trying to capture that data. So I'm wondering how you deal with that data gap.
that's what we're trying to capture right now. So that's
Okay.
one of the things. So we're working towards getting our hospital system on this as well.
Okay.
So that's a lot of them just drive themselves, or a friend drives themselves to the ER after they overdose, and they're not getting captured in this specifically, but we can have the ER actually add in that as well. So we're trying to get all that data in there. So all the different sources. Mhm. No,
From the are you getting
Not
pushback
really,
from the
no.
hospitals?
No.
In regards to that information, just because of HIPAA and all that, although like are they still very leery of it?
The more so they just don't want extra like responsibility work to do, but it's something that it's fairly easy to like enter it in there. So it should be it's in the works. So we'll probably get it going here soon.
Do you have an IHS clinic, or are you 638?
638.
You guys are 638.
And thinking about the reporting of overdoses that maybe weren't seen by EMS or at the hospital or by law enforcement, I've wanted to do a pilot project, and I think it's primarily been something that will need to be done with the tribal community, because I think this probably happens more, is finding a way to maybe have like a harm reduction, a syringe service, but somebody that's community embedded point of contact that would then kind of be like the person that reports it. But in a way, maybe it's where the Department of Public Health, that way it's not identifiable as that individual was the one entering it per se, but it's part of that. But then you're better understanding of what's going on, and hopefully advocating for additional resources because there is that additional data available. But I've been talking to a lot of different folks about wanting to do some sort of pilot with this, because they hear, oh, it's not eligible for like nonprofits, and then it just kind of stops there. But we have some workarounds to make it to where that can, as long as they partner. So I'd be happy to follow up and kind of explain my thought process, but I've definitely wanted to find some sort of pilot project to see how that would work, and making sure we're still respecting confidentiality for everyone that would be entered here. And it's not necessarily about entering it as timely. It's just a matter of building in that protocol to better understand kind of what's going on.
So I'll talk a little bit about the history of how we started at EBCI. So first, about 5 years ago, we got together. We noticed that there was a lot of overdoses in the community, and we were trying to figure out how many overdoses. So we gathered all of our health data that we had. So from the RPMS, from the hospital system, and other sources. And we invited PD, EMS, and the hospital, and everybody else all in a room. And we said, all right, what's our data look like? And we presented the different sources of data, and EMS was like, that's way lower than what we're seeing. We're seeing a lot more cases than that. So that was kind of like a starting point for us. We're like, all right, our data is not right. We're missing a lot. So what do we do? And then about not even like half a year later, we got a opioid grant, opioid grant. And one of the recommendations for that was ODMAP to use it for. And we're like, what's ODMAP? So we had no idea. And so we got to look into it a little bit more, and like it was free, easy to use. And so we talked to, I believe it was our police department first. And then they said, you know, why don't you get a hold of EMS? Because they're the ones that like respond to that. So we're like, okay, EMS sounds good. And we brought in ODMAP, the people from HITA, and they did like presentations and everything. And they're like, yeah, we can do this for EMS. And that's kind of how we started. So it's very simple to use. They have no issues with EMS to use it. So what they don't do it right on spot. So what they do is they do it at the end of the day or at the end of their shift. EMS does. So it's not real time like some other places that they're able to do it real time. So you can have like a handheld if you want to do it real time and just enter the data right on there, but they'll do it at the end of the day, and then it'll be all updated on there, which is so for each, I'll also mention, so weekly I'll go in, and then so one thing I'll send it the snapshot of the weekly things to our syringe service program. Then also we have different stakeholders in the community. That one of them is our PD. So I share data with the PDs, some snapshots of this. So just so they're aware of the different sources or different things going on. And then also we have a tribal action committee in the TCC. So this is part of a resolution that happened in tribal law to actually look at overdoses in the community. So I share it with that committee. So the different overdoses that happen. So I'll do a monthly report for them. So it's definitely some good data sources, and just to keep the community informed. And also we have, you might be familiar with the CHIP, so Community Health Improvement Plan, or the THIP. So what we call a THIP. So ours is the Tribal Health Improvement Plan. So we use this. This is one of our indicators right here, is the number of overdoses per year, and then also the number of overdose deaths per year. So we'll use this data right here to drive those indicators that way. So it's a lot of different uses, and the data is a lot better than what we were able to pull just from hospital data. So it's a lot, it still needs improvement just to get like the last few that are just like not EMS isn't going to, they're just going to the hospital and other sources. So, but it's definitely, we're going to make it really good though here in a couple months. So, but it's already really good. It's a lot better than what we had before. And it's so awesome that it's just free and easy to use for everything. So, question?
Do you track drug type on here, and can you map that based on color? So if you see a cluster rise in fentanyl or heroin use or something like that, or do you guys look at that?
Yes. So
Yeah.
there is the suspected drug type on here. So you'll see, I think it was on here. Can show that again. Suspected overdoses by type. Oh, okay. It was on the other one, wasn't it? So
There's no chart, right?
no chart for that. Okay, so there's no chart, but yeah. Yeah, so you got suspected drug there. So what I do actually is I download all this and then work in it in Excel or ArcGIS also. So you can put it in ArcGIS, you can just download all this and you can play with it on there, or just Excel. You can like create different charts and stuff from there too, what you want. So all this information will be available to download if you want. And so all the things that, all this information that our EMS puts in, I'm able to download and do with not anybody else's data, just the tribal EMS data.
To add to that, one of the features that we have probably in the next 6-ish months is expanding on drug type, because since ODMAP was established, polysubstance is also a big concern. And so we're looking to explore that. I would assume that we would need to also do a drug type chart to build off of that. The hard part with ODMAP is it's like 30 to 40% of agencies submit information on suspected drug. It's actually fantastic that this EMS agency is, because for EMS, they're less likely to submit information on suspected drug because they want that confirmation that it is in fact that. It's mostly been historically law enforcement. So we're trying to work on building that up, but that's why right now there's not necessarily a chart, but there's definitely a need, I think, for both a chart and the polysubstance option. So I'm taking a note that we got a feedback about that. I can
Yeah,
advocate
so
for it
drug
more.
type is then self-report on
Yes.
site from either
Yep.
the patient or whomever's there, right?
Yeah.
Okay.
So for EMS, like some of them have like coding protocols where they'll use ICD-9, ICD-10 to help, indicate what it might be. It's becoming harder and harder to assume that just because they respond positively to naloxone, that it's heroin or fentanyl,
Right.
because most of the time they would just rather not include that because they're not sure what it might be. And so that's why I think we've not seen that as much, or people will go in and add it later. But for law enforcement, they're like, oh, this person responded positively to 4 doses of naloxone. 1 didn't work. There's paraphernalia. They have a history of substance use. They're more willing to call it heroin or fentanyl or opioid than some of our other agencies. So that's why if you use ODMAP, you won't always see it in there, is because they're not ready or have the wantingness to report that, because there's not enough confirmation of what it might be.
Thank you.
Yep. And also when you're able to export on here, I believe that this doesn't include like the sex or age breakdown on here, but that is something that our EMS does put in. So when I export, I could create different charts and stuff with that on there as well. But these are some good like set things that you can share with different stakeholders in the community and stuff like that. It's good, I think. So that's how we use that.
I actually have a question too. So you may have already addressed this, but on that, like the type, they're different colors. Does that color relate to what you see on the actual map of like the different colors?
Mhm.
Okay.
So there's actually a key right here. So your diamonds are fatals and your circles are non-fatals. The easiest, cheesiest way to remember is it's circles of life. So they survived. And then they are color coded based on naloxone administration. So like red diamonds are going to be fatal, no naloxone. And then you'll see a lot of greens and purples, and those are going to be multi-dose, single dose for non-fatals. The only caveat is like the state of Indiana does not track the type of naloxone administration. So the whole state is gray because it's just naloxone unknown, but that is an option. It's just for them, they wanted to report statewide. This was just their caveat, was they had to do this. So there's that option as well though.
Yep. So let's see. I don't know if there's anything else that we'd like to show on here. Let's see, you got filters. So just I don't know if they saw the filter capability on here. So this is where you put like incident date, time. So that's where we have it set now. And let's see if I can figure out this Mac here. There it goes. So then if you want to like filter it to just show fatal or non-fatal, naloxone administered, And then you can also go by zip code area. And if you want to just search by primary suspected drug, if any. And so this is where I filter for tribal EMS right here. But you can enter, I think, how many to 5? So, yeah, 7. Oh, so you can filter by up to 7 on there. And then if it's a multiple victim scene or day of the week. So a lot of different capabilities. It's really, once you go back in time, like we started in 2018, but our EMS backdated a lot of our data to 2017. So we're able to see all that over the time. And then once you put on this heat map, that's really, you can definitely see, let me see if I'll show you the heat map function on here. There it is. So you can see that it's really neat to actually see, this is like where it's highly concentrated. So that's right where our casino is. And then over here in this Birdtown area, that's also a hot spot in the community. Then you also have some different spots around there. So it's definitely helpful for just many different stakeholders in the community just to see this, to share it with them and all the data. So any other questions? I don't know if
Especially when you were starting, did you have any issues with EMS like not entering the data and it wasn't like 100% of EMS responders were entering the data?
So we have 2 people that are, or actually 3, that had the capability to enter into here from EMS. So they're the main ones that actually put it in. We never had any issues with them like not wanting to put it in. They were on board. We gave them all, they all went through different trainings by the Washington Baltimore HIDA. Then we had different trainings for our PD as well, just so they were aware of the OD map, the use for that. So there's a lot of different trainings that they also provide for everyone. So.
And so if a tribal community or an organization wants to sign up for ODMAP, how do they do that? And is there anything you recommend kind of having in place or talking through before you take the step to start signing up?
I think you might be the best to answer that.
Yeah. So because it is a limited group that is eligible to join ODMAP, we ask that every agency, once they are ready and have thought through if it's a good fit for them, and if so, what the best methodology for data entry, if they are going to be entering data, is to just go to odmap.org. And then we have our agency tab. And then you'll just request agency access. So you'll just fill out the form here. We do ask that we have what we call a signatory. This needs to be somebody who can speak on behalf of your agency, not just somebody who signs up and then, their boss comes and says, why did you sign up for this thing? What is it? So they need to be someone who can speak on behalf of the organization. And then we also have a role called the agency admin. This is going to be kind of the person day to day who's responsible for managing users, adding them in for that specific agency. And they don't have to be the same person, but you need to have 2 people on board from your agency to join. If you have differences, but it can be about the same person. And then once that happens and you click submit, then we vet every single agency, make sure like that person still works there, that they can speak on behalf of the agency. And then if we have questions, we'll follow up. My coordinator, Marquise, is very thorough. So he reaches out to a lot of folks and makes sure. And then you'll sign that participation agreement I mentioned, and then you'll get access to ODMAP. You'll start off by just having the agency admin and signatory as users, but it's really easy to add additional users for your agency. You just need to give them, they just go to odmap.hida.org, and then they'll sign register as a new user and then use your agency code, which is your unique identifier, and they'll be able to join your agency. And then the agency admins approve them. We do not approve the users. That will be the agency admin. But then the trainings that Mark mentioned, we do have a ton of them currently on our website, as well as our YouTube channel, different resources, one pagers on how to set up ODMAP, how to use ODMAP. But we're always available for additional like hands-on trainings, whatever it might be. Any other questions?
Our partnership. So USET is actually, we partnered with EBCI to be our subject matter expert for ODMAP. So Mark has previously done some ODMAP videos that there's a set of 5 that we have recorded and we can send out. So it's just basically talking about the whole process of ODMAP and how to do it. And he's an additional resource for us. Policies, procedures, or anything that they have that they would like to share, we can always connect you to them. Is there anything else on that?
Yeah, if anybody, feel free to reach out to me. I'm sure we could probably send my email out or something. If you ever want to have any conversations about it or any other substance related activities that we're doing for EBCI, we're doing a lot of different good things in our community. So we're really excited about a lot of stuff. So feel free to reach out to me.
So the other thing that we were kind of talking about and thinking about doing is piloting ODMAP within USET with all the tribal nations. You know, just Mark started out with EBCI, now Catawba, and there's some others that we would really like to get involved in this this MAP process. So we have some of the other tribal nations that are currently doing an opioid task force as well within their community. And with that said, they are trying to figure out ways to connect and do ODMAP, but also to collect the data to keep, internally for their different organizations. So housing, tribal justice, and some of the other areas that we have included here. So there's more that could be done. We'd really like to hear from you, if you don't mind at this point, to hear what you would like to see moving forward. Anything you would like to add on your tribe? Yeah.
One of the big things that I'm really interested in using this for also is we're working towards a mobile crisis response team on the reservation in collaboration with public safety. So we really want to be able to provide consistent training for our team, for public safety, and even for our York County law enforcement and EMS as well, so that we all kind of know we're all on the same page, because we do have that cross jurisdiction where we utilize some community-based services outside of the tribe. So.
We're trying to include them in the meeting.
Okay, thank you. I just had a general question. Do you know if the state of Rhode Island is set up for this? I don't mean necessarily the Narragansett tribe, but yeah.
So the state of Rhode Island, actually, can we end the video? This might help answer your question. So we're going to end the video here, so that way I can demo the whole site itself and show you kind of where we're at.